Hi, my name's Todd. I'm a nurse practitioner here at Contour Dermatology, and today I'm going to talk to you a little bit about rosacea. Rosacea is that redness that people get in their face, and they seem to never get rid of it. There are different types of rosacea that we'll talk about later on, but today I just want to talk to you a little bit about who has it, who gets it, what it's not, what it is, and how to treat it. What it is we don't really know. The etiology is unknown. We do know that heat tends to trigger it or exacerbate it. There is also some speculation that the Demodex follicularum skin mite, may contribute to it by causing a mechanical blockage of hair follicles, and that leads to inflammation or even an allergic reaction. But research shows that the number of mites that are in people that don't have it, or I'm sorry, the number of mites in people that have it, and then after their treatment, it seems like the number of mites are the exact same. So the treatment itself is helping with the rosacea, but it's not decreasing the number of mites. What it's not is it's not associated with alcohol. Alcohol may accentuate the redness in the skin, but it does not cause rosacea. So for many, many years, we thought that alcohol was the cause of rosacea. And there are different, like W.C. Fields for people that are older, had a very, very red face. He had a gigantic nose called rhinophyma. And that's a type of rosacea, and he happened to be a very heavy drinker, but that did not cause his rosacea. Sun exposure may precipitate an acute episode, but sun exposure is not necessarily a prerequisite for rosacea. There are two different ways to diagnose rosacea. We call them phenotypes, and a phenotype, if you have a primary or a diagnostic phenotype, like that characteristic redness in your skin right here, redness in your cheeks, redness along your nose, those little vessels along your nose, and then even redness on your chin, that's stereotypical of rosacea. It is a diagnostic feature of rosacea. If you have that big W.C. Fields nose that's bumpy, that can also be a diagnostic criteria for rosacea. There are also some what we call major phenotypes, and that's just skin flushing, those papules and pustules, those little things that come up on your skin. They almost look like acne. It's very different. It's very difficult to differentiate some of the time between the papules and pustules of rosacea and adult acne. Another phenotype, another major phenotype would be telangiectasia. This is something that I treat a lot. Those are those little vessels that are around the side of your nose. I tend to get magnifiers on and look at people's face very, very closely, and I can see them in the making. I can see little tiny vessels along people's noses, on their cheeks, on their chin a lot, just like the normal appearance of rosacea. And then there are also ocular manifestations. You can get, and I happen to have ocular rosacea, and it's not incredibly common, but you can get those little telangiectasia that I was talking about right along the borders of your eyelid, and you can also have what we call scleritis, where the whites of your eyes get very, very red. As a side note, before I was being treated for ocular rosacea, I had somebody ask me if I'd been smoking pot, and I do not smoke pot. But my eyes were so red from the heat that was outside, because we live in the desert, the heat that was outside, and I walk inside, and that heat had made them bright red, and so somebody asked me if I'd been smoking pot, which is not a good look. So who gets rosacea? It's people of Celtic origin, but that is not they're not the only people. I happen to be Irish, so it's really common with people that are fair complected. But that does not exclude people of other ethnicities and races. If you've ever seen people flush, like of Vietnamese descent or Asian descent, and they flush in your cheek, that's rosacea. It is rare in children, but it does occur in children. We see teenage boys that go, or teenage girls as well, that go out and they run, and the heat of their body increases, and they get these big, gigantic red cheeks. It's rosacea. There are 4 different kinds of rosacea, or types of rosacea. One type is vascular. It's also known as erythematotelangiectatic. I think vascular is easy to say. Second type is inflammatory, also known as papulopustule. It's the one that mimics adult acne. Phymatous, also known as rhinophyma, and that would be an overproduction of sebaceous glands. The reason why people's noses get big and get kind of nodular, they look bumpy, is because it's an overproduction of sebaceous glands. And then, of course, there's ocular that we've already talked about. There's several different types of treatments. Oral antibiotics and the use of tretinoin, also known as Retin-A, is very common. It happens to be the one that I use. I use doxycycline, which is the only treatment for ocular rosacea, and then I use tretinoin with that. Tretinoin is a vitamin A derivative, and I use it at night because the molecule itself is very sun sensitive and will break down and become ineffective if I go out in the sun after I put it on my face. There's also, for resistant cases, we can use metronidazole. We can also use an azithromycin taper. There are topical medications. Tretinoin is a topical medication. You can also take a low-dose isotretinoin or Accutane, and that's how we would treat acne, or certain types of acne, and we can also treat rosacea with that. The topical medications are metronidazole, also known as Flagyl, benzoyl peroxide, some of the same things that we would treat acne with, we're going to treat rosacea. A sulfur and sulfa combination, azelaic acid, Elidil, and Soolantra. Soolantra is ivermectin. Ivermectin is a treatment for skin mites. And we have an oral medication, or an oral ivermectin, that we can give somebody in very resistant papulopustular rosacea. Another treatment area would be for flushing, or we call erythema, redness. A medication called Mirvaso will bring some of that erythema down. Rofade is also another medication that will help bring that down. And then there's a heart medication that regulates the heart and decreases the blood pressure called carvedilol, or Coreg, and that will help decrease the redness in the skin. And of course, for all of the things that we talk about in dermatology, we always want you to use sunscreen and avoidance of triggers. And that's pretty much with anything. If you have allergies, the most important thing to do is avoid the triggers. If you have rosacea, avoid your triggers. And you can figure out your triggers by kind of keeping a diary, writing down what you've done before you have facial flushing. But that's my presentation for today, and I appreciate you watching it, and come back and see us more often. Thank you. Bye-bye.